TAVR stands for Transaortic Valve Replacement. At Memorial Hospital, we started performing TAVR in 2014. Initially, it was only approved for patients who are inoperable or extremely high risk for surgery. So they had to have an operative mortality of 15% in 1 month post-surgery to qualify. And they had to have what we call a Society of Thoracic Surgery or STS score of above 8, so that would put them at extreme risk. Those patients eventually did very well. Gradually, the TAVR procedure has evolved to intermediate risk and even now to low risk. So I think we're very hopeful that the studies that are evaluating low-risk patients now could also be considered as a regular patient for TAVR procedure. The goal of TAVR is to improve patient quality and improve their survival. So we achieve both of them very nicely with this procedure, and you can immediately see patient having relief of their symptoms of shortness of breath and chest pain. And of course, with the studies and with our own data, we've shown that patients have lived longer, and so we're actually doubling the survival of these patients who were previously would have sadly passed away. The procedure is done in a hybrid cath lab, which is a combination of an OR and a cardiac catheterization suite. Typically, it's done through a groin access. So in your groin, if there's a femoral artery, you access it through the artery and pretty much can do the procedure with conscious sedation and local anesthesia. That procedure is done in a minimally invasive fashion with no incision. Very small hole through the femoral artery. We call it a percutaneous approach. Patient is consciously sedated, so basically they get a twilight anesthesia. There's no general anesthesia, there's no tube in your mouth, there is no central venous access or central arterial access. Typically the procedure takes about an hour or less to do. So once you put this plastic tube, which is the delivery system, through the small tiny hole in your artery, you can bring the valve which is housed in this delivery system and then cross the native valve, that's patient's own bad valve that's narrowed up. Patient does not feel anything throughout the procedure. After the valve's deployed, we do some echo testing before and after, and patient generally goes to the recovery room and then maybe even a step-down unit, not even an ICU. And this usually discharged within 48 hours, so typically most of them go home within 24 hours. Patients tolerate the procedure very well. There is no downtime. Patients are loving it, so we've done several and with excellent results. People can expect a significant improvement in their quality of life. It's relief of symptoms of chest pain and shortness of breath, and so it helps them do their regular daily chores like cleaning, vacuuming, doing grocery shopping, and just enjoying generally their family and their friends, and being able to walk around the neighborhoods and just enjoy life. It is not a scary procedure. It is a very fascinating, groundbreaking procedure that improves your survival, in general improves the quality of life.